In this video, we're gonna look at our main medical surgical lab, Lab A. So whenever you leave the lab, this is what it should look like. So we're gonna go through and kind of talk about each section. So each of our stations here should look exactly like this before you leave. So they're all set up to be uniform. So you have a nightstand with the sharps and often some hand sanitizer. You have your IV pole here. And then when we have occupied beds, we want the occupied beds to be made like this. So we're not gonna do our normal mitered corners here. We're going to fold the blanket neatly, place it across the lap, and tuck it in. And then we want the head of the bed slightly elevated. We have our bedside table at the end here with a chair, a trash can, and then a chair over here. And this is how each station should look exactly prior to you exiting the lab. Each bed has a mattress protector, a fitted sheet, the pillow with the pillowcase. We have a draw sheet, and then we have this top sheet, and then the mannequin should be wearing a gown. And as we go through, you can see, so we have a divider here, and then we repeat that same setup. A chair, a trash can, bedside table, pole, nightstand with sharps, and the occupied bed with the blanket folded neatly and tucked in. So again, each station prior to leaving the lab should look exactly like this. In the middle back here, we have our Pyxis with the hand sanitizer station and a trash can. And then our stations just repeat with that divider in the middle here between each bed. So this is what we want this lab to look like prior to you leaving. You can see nothing on the counter, the instructor station. And then we're gonna go back here and we're gonna look at our stretcher. So the stretcher is set up exactly the same way. We have our nightstand with the IV pole. We have our occupied stretcher with the blanket folded neatly. Our patient there with a bedside table, a chair, a trash can, and a chair. And then we do have extra chairs that are usually stacked here. If you do move a chair from this area before you leave the lab, you should return the chair to this location. We don't want those chairs left out in the lab. The same is true if you are using the wound care butts. Before you exit the lab, these should be cleaned and returned back to this area. And then over here, we have our supply room. So if you have visibly soiled linens, they should be placed here. And then the supplies should be kept where you find them at. So for example, if let's say you use the IV arms and you remove arms from a case. If you remove it from a case, it goes back in the case. Don't just lay it up here with these others or put it on the top. It needs to go back in the case. The other really important thing is some of our supplies we reuse. So our ambu bags, particularly our oxygen devices. So you can see anything that's in one of these like Ziploc type bags, we're gonna put the items back in the bag and return it when we're done, right? So our nasal cannulas, our Venturi masks, all of our oxygen devices, they're gonna be put back in here when you're done with them. That allows us to reuse those and them to be stored properly. All right, so this is what your lab should look like before you leave. Okay, so here we have our nursing student lounge. So the nursing student lounge should look like this before you leave. we do want all these chairs to remain in here. So if you use a chair from here into one of the other labs down here, before you leave, you should return the chair to its proper location. We also want to make sure that there are no open food items left in this lounge. So if you have an open bag of chips or something like that, those need taken with you or thrown away. Please do not leave those in the lounge. The other thing is, when you're heating up things in the microwave, please be sure to cover those. If there are spills or splatters, you need to clean those up. Next, we're gonna look at our Lab B. This is our more assessment and pharmacology lab. You can see in here we have 3 unoccupied beds. So when we have unoccupied beds, we want those made differently. So here you can see this bed is made with our normal hospital or mitered corners. And there is a video in your nursing lab manual. If you are having trouble with that, it is your responsibility to be able to make these beds properly. So should have a sheet on the bed with a pillow and the green blanket with that folded properly and made with the mitered corners. And anytime there's an unoccupied bed, this is how it should be made. Okay, so we have our 3 beds in here with our 2 tables, and you can see the counter is nice and clean. Only the things that are currently there should remain there. And this is how your Lab B, your assessment lab, should look before you leave. And these beds need to look nice and neat before you leave. On this side, we have our practice lab. So this is the nursing student practice lab. This lab is open anytime that the university is open. So you are able to come in here and practice anytime. There doesn't need to be an open lab instructor for you to practice. Now, if you have required hours and things like that, you will have to sign up using the link to make sure you're here when an instructor is present. However, if you want to come and practice between classes, you can do so. So this is what your practice lab should look like when you leave. So we have an occupied bed here. So we have this same green blanket, only it draped across the lap and tucked in with the head of the bed slightly elevated with our bedside table. We do have 3 full-size mannequins in this lab. A lot of times we'll utilize these tables as a temporary bed, depending on what skills you're practicing. So you are free to move the mannequins onto the tables. But again, please put it back where you found it, where it belongs, before you leave. The same goes if you use an IV arm or wound care or Foley. Whatever you're using, this is its designated location. So this is where it needs returned to before you leave the lab.